And here we are. Good evening, folks. My name is Scott Chesney. I want to welcome you to part 2 of our bowel care educational series. We're talking about autonomic dysreflexia and bowel care management tonight. And obviously, I could not do this alone. So I want to welcome our guest tonight is that we have Margaret Swanko, who's Director of Sales and Education for Quest Healthcare. Hello, Margaret. How are you tonight?
Hello, Scott. I'm doing well. And yourself?
Fantastic. Thank you.
Good.
Thank you. And then we also have Ryan Gebauer. I knew I pronounced that right for a change. National Community Relations Advocate for Quest Healthcare. How are you this evening, Ryan?
Good, Scott. Thank you for having us on board.
Fantastic. Thanks for being with us. Before we get into this, though, we want to obviously thank our sponsor, Enemeez, and for all the work that we do. But Margaret, we're going to have you, if I can do this properly. Let's get back in here. So let's go to the next. I think let's make sure we're on here. Want to get back into our screen here. Everybody, thank you for this. Oh, here we go. Okay. There we go. Take it away, Margaret.
Thank you, Scott, and welcome everybody. And thank you for joining our presentation on autonomic dysreflexia. But first, I'd like to take a moment and talk to you about the product the Quest Healthcare has for you. It's our Enemeez and Enemeez Plus. Could we have the next slide, please? Enemeez and Enemeez Plus has been on the market for over 15 years. And we work with many of the spinal cord injury and car facilities throughout the country. Enemeez is docusate sodium. So basically 283 milligrams of docusate sodium. It's a rectal formulation, a little mini enema. And basically what it does is draws that moisture from the mucosal lining into the stool to help soften it. There's also inactive ingredients in there of polyethylene glycol and glycerin. They all work together to help you have a natural evacuation. The beauty of the product is that it works quickly, so you're not going to be spending hours worrying about your bowel care. It typically works within 2 to 15 minutes. And there is no mucosal discharge and virtually no incontinence. It's a non-irritating formula that is easy to use rectally. Next slide. If you're interested in trying Enemeez samples, we have our mini enema available to you. You can get a 2-week supply if you go to enemeez.com, request samples. So thank you, Scott.
Fantastic. And thank you, Margaret, and thank you, Enemeez, for sponsoring this program. So we're going to dive right into this, and you're going to hear us refer to it as AD from time to time. But Margaret, tell us, what is autonomic dysreflexia?
Well, autonomic dysreflexia affects those spinal cord injury individuals that have that T6 level of injury and above. So what it is, it's a syndrome. It's characterized by that abrupt onset of excessively high blood pressure, and it's caused by an uncontrolled sympathetic nervous system discharge. So what that means, think about it. Your sympathetic nervous system is that fight or that flight system. So that's what's discharged. It's that amplified response. The thing is, if it's not treated quickly and properly, autonomic dysreflexia is potentially life-threatening and is considered a medical emergency. If not prevented promptly, it can lead to stroke, seizures, and even death. May I have the next slide, please? So let's talk about the pathway, because this is really interesting, because I said you have that stimulus, that, basically that sympathetic nervous system that's really stimulating everything. What you need, though, is that parasympathetic system. You need those two systems to work together. So what is your parasympathetic nervous system? Well, that's your rest, digest, feed, and breathe. So that's calming you down. Your sympathetic nervous system is rushing you up. So what happens, you have this noxious stimulant below that level of injury, below that T6 level. And it could be a bug bite. It could be sunburn. It could be the fact that your shoes are too tight. It could be a painful bowel movement or a kink catheter. It could be a whole host of things. So what happens is that those nerve signals are then sent to the brain, and the brain says, oh my gosh, something's going on. I'm going to block that injury. And so it cranks up that sympathetic nervous system, and that's where you're getting your hypertensive response. But the problem is your parasympathetic system is activated, but it can't reach that level of injury. So what you're looking at is that essentially the stimulation of one branch no longer corresponds with that suppression of the other branch. So you have that negative feedback loop where neither one is really working the way it should. Next slide.
That's why we have you talking, because you're so intelligent on this. I like to tell people that, like, I just feel off. And it's not like, it's not the cold. It's not like I just have a fever or some kind of virus. Is that like, I just feel off. But this is getting to the root of why this takes place. And let's jump to the next one. So tell us, Margaret, what are the early signs and symptoms of AD, autonomic dysreflexia?
Well, the scary thing, Scott, is that you may not even have any symptoms. That's really the scary thing. But some of the early symptoms might be something as simple as nasal congestion, sweating, goosebumps, but usually the first two signs and symptoms are basically the flushing of the skin above that level of injury and that pounding headache. And I'm sure that you and also Ryan can talk a little bit about that.
Ryan, why don't you tell us, because I know there's some people out there that are thinking that, you know, when I'm sweating, does this mean like I'm overheating? Am I having AD? And then I also want to ask you, do you pop a Tylenol? What is it that you do to care for yourself? Because I know you've battled AD from time to time.
Yes, thank you for the question, Scott. 26 years ago, when I was injured and I was in ICU, I was having sweating symptoms. It wasn't educated to myself, neither my family, that the sweating symptoms are actually autonomic dysreflexia and what that actually meant. So the assumption was that I was overheating with having layers of sheets and blankets on me, as we tend to know that being in the hospital, it's quite chilly and cold. So putting layers of blankets and warm sheets that they used to heat up for me, and just piling them up eventually made me hot. But what the bottom underlying issue that I was having at the time was that I had a stage 4 wound. And the wound, medical team was trying to determine to either do a skin flap or to have it heal naturally. And I was experiencing urinary tract infections. So these two in combined were actually activating that AD symptoms. Taking a Tylenol is not going to help. When I was in the ICU, Tylenol was given to me just for the fever aspect of it, from dealing with the urinary tract infection, but that's not going to eliminate it. Fortunately, once I got into the rehab stages, education started becoming more imperative, and that's where the AD 101 in essence was taught to myself as well as my family, and how important it is, and if it's not taken care of, how deadly it could be. Taking a Tylenol with the education wouldn't do so. My physiatrist, the rehab doctor, when I was in rehab, had educated about nitro paste, and also had prescribed me with nitro paste for future if I were to have any type of symptoms.
So folks, I want to, and you're what level again, Ryan?
I'm a C3-4, cervical 3-4.
Okay, C3.
Complete.
Complete. And I'm a complete T7. So we have paraplegic, quadriplegic, but just as there are no two spinal cord injuries alike, you put them all up on an MRI. is that the symptoms for each one of us with AD, it could be all the above of what Ryan mentioned. It could be something. I know Margaret was talking about a bunch of things. One of the things that I remember someone telling me was their clothing was really tight, like they had really tight socks on or something, and they were unaware of it until they got to the hospital. And then they were kind of like scouring them from stem to stern and realized it was a real tight sock. So I want you to know that Ryan listed so many of those symptoms, and it could be all of them, it could be one of them, or it could be none of them. I'm just saying is that when there's that feeling of something wrong, and the longer that you are spinal cord injured, the more that you kind of might feel it coming on, maybe not knowing exactly what's causing it, but knowing something is going on that's not right. That's when you can give it more attention. But in the early stages is that it's good even just to tell someone, listen, I'm not feeling right. And so whether it be a doctor or even the emergency room, and I don't want to push the panic button, but it is something to take seriously, and knowing something that is definitely not working properly in your system. So Margaret, can you take us through, still on this slide, but the sweating as well as the other bullet points here?
Yes. So early signs and symptoms, it's so important to know what your base blood pressure is. I mean, that's very important. They say the normal blood pressure for a T6 level injury and above is usually around 90 over 120. I mean, it can spike, your blood pressure can spike anywhere between 20 to 40 millimeters of mercury. So it's really important to know your baseline. You may see no symptoms, you may see the nasal congestion, but then, many of the times what you're going to see first is that flushing and that pounding headache.
Okay. Go to the next slide. So what are the 3 common causes of AD, Margaret?
So it's number one is your full bladder, and a lot of that has to do with the bladder distension, because you could have a blocked or a kink catheter. That attributes to almost 85% of the causes of AD. And then next is your full bowel or your painful bowel movements. It could be hemorrhoids, it could be fissures, anything that's having to do with the bowel. That's why it's so important to make sure you do your fluids, you do your fiber, you do all of those good things so you don't have that constipation and the buildup of those hard, dry, rocky stools. So when you're looking at that full bowel, it accounts for about 13 to 19% of the AD cases. And then skin impairments. I started off by saying a whole host of things, but again, it can be anything with the skin. I mean, you may have experienced, or some people that may have experienced some skin issues with AD. You just described somebody with tight socks. Ryan, do you have any other situations you can explain that may deal with skin and AD?
Yeah. Well, as Scott has mentioned, with having a clothes that might be too tight, but even sitting on a seam, blue jeans, those hard surfaces or the rivets from a blue jean pockets or a button from a pocket that can be pressing into the skin over a long period of time. One of my other issues that I had that I'm now proactive about is with socks in general, is having an ingrown toenail. And if my toenails aren't prepared and taken care of proactively, which I have a podiatrist that comes out to my residence every 4 to 6 weeks, just to be proactive to making sure I do not get an ingrown toenail, because about 20 years ago, an ingrown toenail had caused the autonomic dysreflexia.
Ryan, I'm so glad you mentioned that. Every 3 months now, and I want to say I've only been doing this for about 2 or 3 years, I go to a podiatrist, and I just go there. I would cut my nails myself and sometimes do a good job. I would ask my wife from time to time, but you know what? I said, I'm going to do this right. And I just go there, I make the appointment. He's fully aware of paralysis and treats many people with paralysis, but just takes care of them. And what's amazing too is that, and again, we're all different, but something to be aware of is that I found out, which probably had caused some autonomic dysreflexia in the past, is that my big toe next to my second toe were kind of like hugging one another. They're like best friends. So what ended up happening is I got some little like spongy circles that were cut. So it actually goes right on top of the big toe and it creates that separation with the second toe. So they're on me right now. I put them on, I let them breathe at night before I go to bed for a little while, but I'll put them on there, but I'm creating that separation. So, right. Thank you for sharing that. I did want to get back to the full bladder because what Margaret was saying, absolutely a kink in the catheter not going in right. But I also want to share from one of those people who, for a period of time, didn't cath for a period of time. So I went from not having to cath to having to cath throughout my 36 years of paralysis. I remember being that teenage kid. I remember being that kid in the early 20s who would go out and party with his friends, do certain things and put off catheterizing at the time. And so while I would void a little bit, my bladder would get distended way too much, which I know would lead to autonomic dysreflexia, different symptoms and so forth. So it's amazing to know what can affect your system. But what's great about this is that it's not pleasurable going through AD, but it's almost like a sign, a warning sign that something is seriously going on with your body and you need to address it quickly. So, okay, let's move on to the next one then. And so, Margaret, what are some tips? We've talked about kind of treating it a little bit and what we can do. We've talked about what AD is. We want to move to a place with all areas of our life of preventing them, and AD is no different. So what are some tips for preventing AD?
Well, resources. It's so important to have those resources available to you. And if I know you're all familiar with the Christopher and Dana Reeves Foundation, there's a great little resource on there just dedicated to autonomic dysreflexia. It pretty much goes through the slide presentation that I just did. It talks about baseline blood pressure. It talks about, a little checklist. Has my bladder been checked? What's going on with my bowel? Is there anything going on with my skin? And what's nice about it, it's a little fold up card that you can stick in your pocket, and there's a place where it talks about the level of injury that you have. So anybody, if you do get into emergency, then they can see that card and they can treat you appropriately. So resources, number one. Number two, obviously we need to keep those bladder volumes down within acceptable ranges. Obviously, we need to put sunscreen on. Anybody in that hot climate. I live in Arizona, I go outside for a half hour, I get sunburned here. So you need to have that sunscreen, you need to keep hydrated. And so important because Ryan had talked about those pressure injuries, and so important, exactly, just lift up for 15 seconds, even every 15 minutes, just lift up and move around. We all do that naturally. And it's important to do those weight shifts because, as we know, if you slide down in your wheelchair, you can get that shear and friction. Your bone is moving one way, your skin is moving another way, and that's a recipe for not good things. And then lastly, obviously, for your bladder, there may be medications out there that are needed to relax the bladder. And I'm sure you and Ryan have additional tips that we can talk about.
Well, I wanted to ask Ryan real quick because it seems like a no-brainer, but I know we have a lot of newly paralyzed people who are part of the Thrive community, and they need a good reminder. Obviously, you see me pushing up, and I need to be doing that often. I mean, I'm coming off having a small pressure sore. But Ryan, what are ways that quadriplegics who might not have full use of their arms or any use of their arms, what are some ways to weight shift as a quadriplegic?
I'm not going to do it this minute because we're doing a presentation, but I will eventually when we get a break here. But I am in a tilt and space chair, which is basically a 90 degrees. So I have a sip and puff, which is a straw in front of me, and I'm able to recline. And reclining back is taking the pressure off my bottom, putting it more towards my back, my scapula area. So that helps me since I cannot physically push myself up like Scott was just doing as a pressure relief in bed every 2 hours.
How
I have
long
a
in the
caregiver.
Right, real quick, I'm sorry. In the chair, though, before we talk about the bed and everything, in the chair, how often will you stay? So let's say you tilt or you go to a different position. How long will you stay in that position for?
2 minutes.
2 minutes. Okay. You could stay longer, though, probably if you wanted to, but for at least 2 minutes.
Correct. And in most cases, when I'm watching TV, I'm in a really good reclined position, so I'm not putting a lot of pressure on my butt as you would be doing.
Okay. And tell us about bed. I didn't mean to cut you off there.
No worries. Yeah, so every 2 hours, a caregiver making sure going from side to side. In most cases, I do side back side just to take the pressure off, but I also got to pay attention that I sit in the chair about 12 plus hours, that I try to stay off the back as much as possible and pressure on the side. And coming off the side, I have my caregiver looking at my heel, my hip, my shoulder, which are the most bony prominent areas, and preventing any type of pressure there. And if there is pressure, to reduce that time, if it consists, to stay off of it and go from side back and then back to side just to keep those pressure levels down.
Margaret, Ryan, I just, these are great. I love these tips. I just probably would add one because you've really covered them all. It's, and I'd probably be saying this to someone who's doesn't have any type of disability, is that we just got to take our time with things. Sometimes we're in such a rush to get places, to do certain things. And yeah, you know what, it might require us to take a little bit more time to understand like how our skin's positioned and what kind of cushion we're sitting on, make sure that it's inflated properly, and to just kind of like cross things off the list, especially if we're heading out and we want to fully be in a place of enjoying ourselves. So yeah, it's a pain in the neck sometimes. I have to catheterize or I want to rush a bowel routine, but knowing full well that if you do, and this is all part of time management, I mean, in many ways, we're masters of time management. In other ways is that we stink at time management. But I think the more that we can get used to a schedule, stay connected to our body, even though in many ways we feel disconnected from our bodies, I think that absolutely will help us to have more awareness and to understand, you know what, yeah, I feel really good. Things are going well. Or, you know what, something's not right here. Let me just get to the root of it. And so I think these are some great tips, and thank you.
Two points that I want to piggyback there if I can.
Yep, I'm gonna go back. Okay.
So in regards to the 15 minutes and 2 hours, with technology today, we have timers, and we can set timers on our cell phones or even our voice assistant technology devices, to help us remember that those are times to do our pressure relief. In addition, as Margaret has mentioned, when it comes to resources education, autonomic dysreflexia can be a scary situation. I remember the episodes when I was in rehab and going through them and learning how to catch it. It's always good to make sure that your loved one or caregiver also understands what those issues are. Having a blood pressure cuff, handy to check your blood pressure, but knowing to troubleshoot, like if a catheter is kinked, that they're aware of what they need to do. Because if you're home with someone and an episode does spark, at least that they are there if you're unconscious or going through a really bad episode, that they can help assist in getting you out of those stages.
Those are great points. Those are great points. And that card, please, that Margaret was talking about before, is that maybe you don't want to put it in your pocket or whatever, because it means like, okay, I got to do it each time like I go out. Is that whether it be a backpack that a lot of people have on the back of their chairs, or even the pouch that goes underneath their chair, is that you can have it in there. And that might be the only thing you need to share, is that, hey, I have a card all about this. Can you grab it? It's in my backpack, or it's in my pouch, or it might be in your pocket. So it's that easy. But as Margaret was saying, it is so detailed, and they made it that way. So it's a quick list on something you can look at yourself if you're not fully aware of what's going on with AD. But again, as Ryan was sharing, which is so important, those that are around you, friends, loved ones, just to say, hey, it's here if you need it, and this is what's going on as well. So wonderful, wonderful. So why don't you take us through this, Margaret, real quick? No, we're gonna start with Ryan, or are we gonna start with Margaret on this?
I'll get started because I know Ryan has a lot to say, so I'll be quick.
the bowel movement. You're going to stop the bowel movement.
Yeah, I had talked about rocky, hard, dry stools. If you haven't look up the Bristol stool chart, because it lists 7 different types of stool, and the very first one are those rocky, hard, dry pellets. You have to think about it. They transit. You're transiting through that colon, and the longer the stool, the fecal matter stays in the colon, the more moisture is drawn out. So it's important that we, drink lots of fluids, eat lots of fiber. And we want to make sure that the program doesn't take longer than an hour, and also there are some medications out there that can cause incontinence and mucosal discharge and skin irritation as a result of that incontinence. I know you did a great presentation a month ago about pressure injuries. So it's really important to, keep that skin dry and healthy. Obviously, if you have excessive gas, that's an indicator that, something is not working right in there. And then again, those lifestyles that revolve around a bowel management program. Your program really should take less than an hour, and you shouldn't have to worry about, am I going to be able to get to my meeting, or am I going to have accidents at my meeting? So it's all of those things that we need to take into account.
Ryan, you're our closer. Do you have some more for this, or?
I'm sorry, repeat that again, Scott?
Did you have some more that you wanted to add to this?
When I was initially introduced to a bowel and bladder program in the rehab setting, I was introduced to a product that did not have the benzocaine as Enemeez Plus does. With me being above that T6 level on the C3-4 complete level, I did experience AD symptoms during the bowel program until I started using Enemeez Plus. And Enemeez Plus has a 20 milligrams of benzocaine, and the benzocaine certainly eliminates my sweating symptoms. So it has been a huge improvement to the quality of life for myself, and using the Enemeez Plus and not having those sweating symptoms, but also keeping those blood pressure levels down for myself.
I love it. I love it. Well, you know what I'm going to do now? I'm going to stop sharing so everybody can see the 3 people here. I have to thank you both. I think this was perfect. It was interesting as I was talking to Margaret before. She's so intelligent, so well versed on this. I said, you got to remember is that
you're too sweet.
People out there that aren't going to recognize some of these terms, but you still put it in such an intelligent way, but yet a way that we could all understand. And Ryan, you were phenomenal as well with your personal experiences, but also sharing about the product. And again, I know they're sponsoring it, and I would never be involved with product that I didn't use myself. And I just, that's one of those things that gives me peace of mind, is having a product like Enemeez to use that kind of takes care of one of those things that's probably one of the most reminding, one of the things that's the biggest reminder to being paralyzed is the inability to kind of like pass your bowels on your own. So knowing full well that you have that kind of assistance, I think is so important. So Margaret, Ryan, I want to thank you so much. We're definitely going to have you back for more programs on here, but thank you so much. You definitely educated us all here, and we'll pass along any questions that we get from the Thrive community to you. Okay.
Thank you so much, Scott. Thank you, Ryan. Have a lovely evening.
Can I mention one last thing before we go?
Absolutely.
Scott, being that you have been working with individuals, educating, inspiring, for 3+ decades, how important it is to educate those who you mentor. And as mentors, as well as support group leaders, it's important for us to share resources and to allow our members and our mentees to return the transition back into the community where it's just questions all over the place. And then bowel accidents begin to happen and humiliation begins to happen. There are products, and Enemeez is a great product that provides that quality of life, that allows people like Scott and myself to continue thriving, to allow wheelchair basketball players to win championships as they did over the weekend, and individuals to get into quadriplegic rugby and go back to work and school and church and synagogue and going and back out with family and not being prisoners of their own home, to getting out of bed, to leaving their front doors, and to leave and knowing that they're not going to have an accident. And Enemeez has proved that over and over and over again with many, many individuals that are out there that are continue thriving. And I'm very happy to be an advocate because without Enemeez, I wouldn't have been able to get over the hurdles that I have dealt with in the last 2.5 decades, but it's also allowed me to continue thriving with a spinal cord injury.
Thank you, Ryan.
Beautifully stated. Thank you, Ryan. I'm just, it's a joy to get to know you, to learn from you, to be inspired by you. And no, you're absolutely right. We just have to continue to spread the word. And anyone who's listening tonight, you've now become one of those people who can spread the word to anyone, whether it's someone who's newly paralyzed or someone who's just being a stubborn old goat, as I am from time to time over 3 decades and anywhere in between. We all need to raise our level of awareness and education. And I'm thinking that we did that tonight. So thank you again, folks.
Thank you.
Bye, Scott. Thank you. Thank you, everyone, for watching.